Hi, how are you?
Good.
Good. Could you please confirm your name and date of birth for me?
My name's Matt.
Okay.
I was born in August 1999.
Okay, and what's your last name, Matt?
Johnson.
All right. Well, I'm Sarah. I will be your MSPO student clinician today. Do you mind if I ask you some questions to kind of get to the root of why you're here?
Yeah, sure, I guess.
All right. So what brings you in today?
I can't use my legs.
Okay. Is it both legs or one leg?
Whatever you think is best.
So can you tell me, were you involved in an accident? I see that you had a brain injury recently. Can you tell me a little bit more about that?
Car wreck.
Car wreck? Do you know when this car wreck happened?
It was a while back.
Would you say a year ago, 2 years ago, 5 years ago?
Something like that, yeah.
So about 2 years?
Yeah, sure.
Alright. Did you have surgery at the time? Any kind of surgeries?
Hey, what's going on? No, I'm just at a doctor's office. It's nothing. No big deal. Yeah, she's just trying to ask me some crazy questions, basic stuff. Nothing crazy. Yeah. Oh no, you don't need. Oh, okay. All right. I guess I'll talk to you later then. All right. Bye.
Alright, you said you're having some problems with your legs. Could you tell me a little bit more about what you're feeling?
I don't feel anything.
From what point on? Do you feel anything in your knees?
No.
Nothing in your knees? What about your mid-thigh? Anywhere in your thighs?
No.
You don't feel anything?
No.
What about on the right side? So nothing from the hip down?
Yeah, something like that.
Alright. I see you're in a wheelchair today. How often do you get out of the wheelchair? Do you walk at all?
I go lay in my bed.
You lay in your bed? Do you have help getting into your bed? Or do you get in there on your own?
Sometimes I try, but I often need help.
Okay. Is this a constant loss of feeling, or do you have feeling at any point during the day?
No.
No feeling at all?
Dang it.
Okay. Do you have any sort of pain with this, or is it just the loss of feeling?
No feeling.
No feeling? No pain though?
No.
So it only feels like, what, tingly, sharp shooting?
It hurts sometimes.
It hurts sometimes? Do you know what causes it? Are you doing a certain activity when it starts to hurt?
No, I just sit in the chair.
Just sit in the chair and it sometimes hurts? Okay. On a scale of 1 to 10, 10 being the worst, what would you rate your pain?
Like a 7.
7?
No. Maybe like a 4.
4? It's a big difference. Does it shoot up to a 7 at any point, or does it consistently stay at that 4?
Yeah, it's just a 4.
Just a 4? Is there anything that causes the pain to go away?
No.
Nothing
Well,
causes the pain?
it sometimes just goes away.
Just goes away on its own?
Yeah.
Okay, is there anything that makes the pain worse?
No.
So it's just a consistent pain?
Yeah, something like that.
Alright. Can you tell me what your daily life looks like? Are you active, or?
I just sit here in the chair.
Just sitting in the chair?
Nothing anymore. I just sit at home all day. If I'm not in the chair, I'm in the recliner or in the bed.
Okay. What did your daily life look like prior to your accident 2 years ago?
Just go to work, come home.
What was your work like then?
Just a desk job.
Desk job?
Yeah.
Did you do any extracurriculars on weekends? Hiking,
No.
sports?
No, I just sat around, played with my dog.
Okay.
He's dead now, so
Oh, I'm so sorry to hear that.
it's okay.
Alright. I'm gonna ask you some questions about your goals. Is there anything that you would like to do that you were able to do prior to your accident?
I'd like to eat.
You like to eat? What would you specifically like to eat? What do you mean by that?
You just said before the accident, I want to be able to eat. Like, I want to be able to, like, sit somewhere and eat.
Okay, so you want to be able to go into a restaurant without the wheelchair? Is that what you're referring to?
No. I'm okay with being in the chair. I'm used to it now. So.
Okay. Alright. What are your long-term goals? So is there somewhere that you want to end up after I treat you?
No. My doctors have always said that I'm gonna be in this chair, so just figure accept it and just move on.
Okay. Would you like to be able to get up out of the chair to transfer to your bed or to your recliner on your own? Is that something that you're looking to do, or are you okay with having the help?
It's nice to be attended to, so I'm okay.
We're gonna jump back to what you're actually feeling in your legs real quick, if you don't mind. Could you explain the feeling that you have?
I don't have any feeling.
Just no feeling whatsoever. And you said that sometimes you try to get into bed on your own and it doesn't work out for you. Are you falling? Is that the problem here?
No.
Okay, then can you explain to me how you have trouble doing it on your own? What's going on during that?
Yes.
Okay, what does that look like?
Wait, what?
What issues are happening when you try to get yourself out of the chair into the bed or from your chair to the recliner? You said you had problems doing it on your own. Could you explain the problems that you're seeing?
No, I just have trouble.
You have trouble?
I just can't do it.
Can't do it. Do you want to be able to do it?
Nah, doesn't make that big of a deal.
Okay. But you said no pain whatsoever.
Yeah. No pain.
Alright.
Well, no pain.
No pain? Alright, I'm gonna ask you a few questions about your family history. If you have a previous history of it, just let me know. So do you know if anyone in your family has a history of diabetes?
No.
No? What about high blood pressure?
Yeah.
No? Cancer?
Uh-huh.
What about heart attacks?
I think like my cousin had one or something,
Cousin?
but
Okay.
no, not really, no.
Alright. And then a few questions about any changes that you've experienced after your accident. So have you had any changes in your vision recently?
No, I just No, I just have glasses.
But you had glasses prior to your accident?
Yeah.
What about any skin issues?
I have some redness,
Redness?
or it itches sometimes, but
Where specifically?
along like my back.
Okay. Any changes in your eyes, ears, or nose?
No.
Okay. Mouth or throat?
No.
Any issues with your neck? Pain?
No.
What about your breathing? Do you breathe all right? Any troubles breathing?
I don't think so. I mean, maybe? No, probably not. No, I don't think so.
You don't think so? Nothing different?
No.
Any trouble using the restroom?
For a while, they had me hooked up to yeah.
Okay.
But no, it's not. I just have help now. They just put me on it.
Any current medications that you're on?
I had a sinus infection.
Okay.
So recently.
Okay.
So I think I'm on like some type of probiotic or something. So whatever those things are called.
Antibiotics?
Yeah, something like that.
No other medications besides that?
No.
Okay. And a little bit about your living situation. Do you live alone, with family, or a caregiver?
No. I live. It's just me and my trailer.
You said you had some people assisting you. Do they come into your home?
Yeah. They just swing by. I don't know. They just come by. They just kind of walk in. So I don't know.
Okay. Do you use any other assistive devices? I know you have the wheelchair. Any other ones you use?
My brother bought me this like little hand grab thing, you know,
Okay.
with the trigger on it. I use that sometimes, like if I drop it or whatever.
Okay.
No, but besides that, like they come in whenever and they either like make me food or they bring me food or stuff like that.
Okay. And then, do you have any stairs in your house? No stairs. No stairs.
Oh, yeah.
You do have stairs?
Yeah.
Okay.
Wait, no, I don't have stairs.
You
I'm in a
don't have
wheelchair. What do you expect me to do with stairs?
You never know. Sometimes on a one-story level, you have some extra stairs to get up to there from the yard. So just better to ask than not to. Alright. Well, based on the information that you've given me today, I am going to prescribe bilateral AFOs to help with some contractures in both of your legs while you are in this wheelchair. And then we will kind of see where that goes. From here, I would like to do some manual muscle testing and some range of motion, just to get a feel of how much weakness you are actually experiencing. Does that sound like something we could do for you?
No. Oh, you want to see something really funny? I have this funny cat video.
Yeah.
You see it?
That's awesome. If you don't mind, I'd like to talk about your legs really quick, just so we can wrap up and get you out of here.
Okay.
Does that sound okay?
Sure, I guess.
Okay. Would would you mind if we did some manual muscle testing and range of motion to kind of get a feel for what's going on down there?
Yeah, I guess.
Would be
If
okay?
if you think it's necessary.
Alright, well, once we complete that, I'm still gonna stick with the bilateral AFOs. Have you ever experienced an AFO? Have you ever used one? Been prescribed one?
No.
Okay.
No, they gave me some kind of like ankle brace thing after I was in the hospital, but
Okay.
I stopped wearing it.
Okay, well,
Because I just couldn't deal with it. It was too much work.
Alright, well, we're gonna try these braces for your legs to kind of help you get through this and hopefully get you up and moving at some point if possible. At least make transferring from your wheelchair to your bed a little bit easier. And then we'll kind of bring you, once we get you fit with them, we'll bring you back in 2 weeks and kind of get a feel for how you're doing with them. Does that sound alright?
Yeah, sure. I'm not.
Alright, do you have any questions for me?
No.
No questions? Alright, then I think we are good to go. We'll start that manual muscle testing and range of motion in a second, okay?
Oh yeah, sure.